Hello everyone, I am Dr. Biswajeet Mitra, an emergency physician at AMRI Hospitals, Dhakuria. So I am practicing in emergency medicine over 25 years. So today, the 17th of October, like every year, we are observing it as World Trauma Day. Now, being a healthcare professional over number of years, we have seen the pain, the agonies of trauma victims, and trauma being one of the leading cause of death worldwide. Now, as every health days we celebrate or we observe, trauma doesn't really has developed any theme for this year, but the theme that we are maintaining over years is to make people aware of trauma, its symptoms, its signs, and how to perform as a rescuer in case of trauma. The beauty of trauma is that trauma can happen anytime, anywhere. Not only that there will be a healthcare provider or a hospital in the near vicinity, but trauma can happen anywhere. At times it is man-made also, like gunshot injuries, battles, as we see that today's world also is not devoid of war. There are wars, there are disasters which are accidental and maybe incidental. But what is in our hand is to prevent the incidents to be and the accidents also. We need to rescue people, we need to take care of the victims, we need to take care of our co-citizens. So the idea of saving people's life in trauma is to create rescuer, is to create awareness amongst the society. Now we at AMRI Hospitals, Dhakuria has developed a polytrauma team in our management system. So the importance of trauma is that trauma, it might seem that there is an injury, so there will be orthopedics involvement, or there will be neurosurgery. As a department, we need their help. But in most of the cases, the complexities are such that we need to involve numerous specialties like vascular surgery, like plastic surgery, like neurosurgery, like we might involve the general surgery or the GI surgery at different point of time along with the existing specialties. So it's a polytrauma code we do have, and we at any point of time we have a polytrauma team. And moreover, after taking care by the involved departments, we need a good ITU team for their survival and their day-to-day progress and changes we need to maintain. Now we as emergency physician being the most important and the primary caregiver in most of the cases, but to bring the patients in a condition from where we can give them a proper treatment, we need good Samaritans, people who will be there. They might be layperson, but after training them, they will be understanding the importance of how to give the care, what are the symptoms, what are the signs, how to transport a patient, how to lift a patient and bring them to the ambulance stretcher. That is very important. Those minutes, those golden hour, as we say, remains to be one of the most important part in trauma management. So there should not be any lay person. Every person should have some basic ideas that how to keep a trauma patient in an ambulance, how to rescue them, how to do the primary care. Now we have done our bit by training the lifesavers like the police personnel, like the taxi drivers, like we have reached out to different society people, like we have gone to the corporates, we have trained those people also, because you might be traveling with your colleagues to the way to your office and there might be an accident where you are the only rescuer for your colleague. The taxi driver might interact with an accident and his co-passenger is in trouble, so he has to be the rescuer. So we need to train these people, and we have reached out to them on n number of occasions. Like we have trained Kolkata Police, the BLS, the Basic Life Support as we call. It's a worldwide, the AHA has done this program which is called BLS, Basic Life Support, and we need to provide this BLS to all the ailing individuals who need this at their time when they are struggling or battling for their lives. So the this is our part, that we are always in touch with the society people, those who were layperson at one moment of time. Because we, after doing a duty in emergency, we have seen the helplessness amongst the people. We should not be just witnessing the incidents happening in front of us. We should be a good as I was mentioning, that as a good Samaritan, one needs to bring do not hesitate to bring your co-citizen and give them a chance to survive. So you should be absolutely fearless in bringing. There is no hassle regarding the legal implications, because the courts has given you cannot even declare your name also if you do not wish to. So, but give a chance to your co-citizen to survive and to get the best treatment, at least in the nearest healthcare facility. And the most important thing from our end that we are doing is to train, teach, transport and treat people, so that our co-citizen, our beloved ones, get the chance for, after being a trauma victim, to live a normal life, or they can be brought back into normalcy. Now with these ideas, we have reached out to different people in the society to teach and train them and make them aware of the fatalities of trauma. Now, as you all know, that it's a struggle between life and livelihood. And suppose one of our soul earner, if he or she becomes a trauma victim, then it is not only the person, it is the entire family who is at a state of shock. And we also know that health being a well-being of mental and physical well-being, as we define the health. So we need to consider the amount of socio-economic factors in case of trauma. We need to consider the psychological aspect. If suppose one of our family member becomes a trauma victim and it needs a lot of time for recovery, so there is a post-traumatic stress disorder which is called PTSD that needs to be addressed. There we should counsel those people properly. We should counsel their family as well. Suppose one witness a beloved ones of their family, suppose some of the family members were going to a visit or traveling somewhere else in a car, and the car got crashed or road traffic accident happened and one of their beloved ones left them. So it is not only the person who has gone, it is for the entire family. So we need to pull our shocks and we need to be geared up for fighting the trauma. We need to be trained, we need to be taught, we need to be aware of the challenges of trauma, so that one day we will all be trauma fighters. Thank you everyone.